Hi, Nick here at MedTech World with Andreas Forsland from Cognixion. Good to have you.
Thanks for having me.
Great. You're here, you're showing off a wonderful piece of medical technology, the device I haven't seen before for the brain. Check it out.
Yeah. So at Cognixion, we're engineering and making available a fully integrated brain-computer interface that combines augmented reality with EEG sensing, as well as sensors beyond EEG. We can track pupil tracking. We can also track cervical motion. So if you think about any kind of neurological conditions that might affect your brain or body through the central or peripheral nervous system, our technology platform enables you to build applications for diagnosing and measuring certain kinds of affects or brain function. It can also be used to develop therapeutics for improving brain function. It can also be used for assistive technology. So think about someone like Stephen Hawking, who has late-stage ALS. He used a very advanced computer to be able to monitor his eyes and his cheek to control a mouse. This system, you can use just your brain to control a communications interface. So there's many applications for this kind of technology.
We're not talking about can be, could be. It's not something that's far off. This is now. This
is here and now. Yeah.
Here now on the market. Where is it now?
It's currently available for sale in the US and Canada. It will be available for sale in the Europe and also the rest of the world starting in 2025.
Great, and where are you looking to sell it into first? Who's this useful to first of all?
Yeah, some of our existing customers include Northwell Health in the United States, in New York State, the VA, Memorial Hermann Healthcare in Houston, Texas. So health systems that are doing research in the areas of neurology, whether that be traumatic brain injuries, including things like stroke, traffic accidents, things like this, or neurodegenerative conditions like Alzheimer's, MS, Parkinson's, ALS. ALS is a very big condition that people are doing research with.
So this isn't a case of, have technology, find the use cases. You knew exactly what you were going after, and you developed technology to meet those needs or the gap in the market, right?
That's right, yeah. So we originally were developing the system for a specific use case in particular. We were building a communications app on the device so that people with ALS and other conditions that can't speak could communicate with the people around them. And we still have that device in the process of going through FDA and CMS. However, we had an overwhelming response to the core platform of what we created, and we had many doctors and scientists that were asking if they could get access to our technology so that they could pursue other indications. And so, obviously, as you know, it's a long haul going through regulatory, and technically you can't market and sell the standalone medical device until it's cleared. So we felt it would be prudent to go ahead and make our technology available to allies that are pursuing really noble outcomes.
And new apps, new ways.
New applications, yeah. So this becomes really the foundation as a sandbox for commercializing all kinds of SAMD applications, which is software as a medical device. So many of our healthcare system customers are initially doing their R&D and research on this platform we've created, and then they're taking it through clinical trials to validate their software. And then we can then help them commercialize that software once it goes through their pivotals and so on.
Fantastic. How has it been for you at the conference?
At the conference?
Yeah.
Oh, I love it. I've never been to Malta before. I was very impressed. I wasn't sure what to expect. It was a long flight from California, so I was hoping it was worth it, and I'd say it's been fantastic. This group that's putting on the event are fabulous hosts, wonderful community, great people, good food, and I think the highlight for me was the cultural tour when we arrived.
Cool. Enjoy the rest of it, and I guess you get to sleep on the way home, right?
I have a long flight home, yeah, so I can try and catch up on my rest then.
Wonderful. Thanks for being with us.
Thanks for having me.
Nicholas signing off from MedTech World.